At Pabau, we are always looking for ways to improve our videos. Please like, comment, and subscribe to stay in the loop with new content. Hi, I'm Ivana, one of the senior medical content writers here at Pabau. A dermal filler treatment form is a clinical document used to record all relevant information related to a patient's injectable filler treatment. It exists to document medical history, facial assessment, product selection, injection sites, consent, and treatment outcomes. This form provides a structured way to capture each stage of care and ensures treatments are carried out safely and consistently. The form is important because dermal fillers are medical aesthetic treatments with potential risks, including vascular complications, infection, and delayed reactions. A thorough record supports patient safety, informed clinical decisions, and professional accountability. It also protects both the patient and practitioner by clearly documenting consent, product traceability, and clinical rationale. In everyday practice, the dermal fillers treatment form is completed during the consultation and updated on the day of treatment. It guides the practitioner through assessing facial anatomy, contraindications, and patient expectations. During treatment, it is used to document the filler brand, batch number, volume used, injection technique, and treatment areas. After treatment, it records outcomes, advice given, and any immediate reactions. Before and after photos are commonly taken and stored alongside the form to track results over time. Best practice includes reviewing the patient's medical history at every visit, as health status and medications may change. Clear documentation of facial assessment and product choice is essential to justify treatment decisions. Common pitfalls include incomplete consent, missing batch numbers, or vague treatment notes, all of which can compromise safety and compliance. Step 1 is to complete the patient's details, medical history, facial assessment, and treatment goals during the consultation. Step 2 is to confirm informed consent, discuss risks and benefits, and take clear pre-treatment photographs. Step 3 is to document the dermal filler product used, batch number, injection sites, technique, and volume during the procedure using a clinic software such as Pabau. Step 4 is to record post-treatment outcomes, aftercare advice, follow-up plans, and attach post-treatment photos if taken. In summary, a well-maintained dermal fillers treatment form is essential for safe practice, traceability, and high-quality aesthetic outcomes. Visit our website where we have over 6,000 free templates and resources to choose from.